Many people, when they think of concussion, they think it requires a head bonk, right? And that is not true. This is Sick Health with Kevin Ban, MD. Our show helps you navigate our broken healthcare system and take control of your own health. Hi, I'm Kevin Ban, an emergency physician with over 25 years of clinical experience. Most recently, I was the chief medical officer at Walgreens, where I led the pandemic response.
Hello, I'm Alex Wallace. I'm a longtime journalist. I was an executive at NBC News and most recently at Yahoo.
Folks, our healthcare system is confusing, it's difficult to access, and it's expensive. So our goal here is to help you and your families stay healthy. Now, there'll be times when you need care, and when that's necessary, we're going to be here to help you.
The best way to support this show at no cost to you is by subscribing to our YouTube channel, Sick Health with Kevin Ban, MD. We have two cases today. The first one is concussions, really interesting topic. The second one is the former Surgeon General and a very large healthcare bill he found himself with.
Before we get started, I'd like to read a message from our sponsor. I'm going to look at my notes. Today's episode is brought to you by C2 Sense. C2 Sense is working hard to bring lab quality diagnostic equipment into the home, priced for everyone. Learn more at haloreader.com.
A plus. A plus.
Yay. Yay.
Okay. Case one, concussions. So I want to start by asking, you've actually had quite a lot of experience treating concussions. Could you talk to me about that?
Right. Beyond being an emergency physician, I worked on a project for 8 years in Tuscany where we did a bunch of different things. We worked on the emergency medical system. We worked on emergency medicine in particular. We did quality, but we also started a pediatric trauma center, and I led that project. So Italy did not have any trauma centers at the time, and so we stood up the first pediatric trauma center, and that was back in 2008. And quite honestly, when you talk about trauma in kids, it's the leading cause of death in children. The number one type of trauma you deal with is head trauma, and it really runs the gamut from minor traumatic brain injuries all the way up to severe ones. And of course, concussion is in there as well. So I've seen a ton of kids with concussions, have thought a lot about this. And quite honestly, I really like the topic. And I think there are some myths that we need to clear up today.
Okay, I want to just do a quick aside. You weren't in Tuscany on a wine tasting tour. You were living in Tuscany because your wife is Italian. Is that correct?
Yeah, well, the whole story of it is that, I am married to an Italian woman from Florence, Italy. And while I like to say that she and I fell in love over time, her father, who is a physician, he and I fell in love, at first sight. And it was really through that relationship where he introduced me to the dean of the medical school. I met the minister of health. And the next thing you knew, we were having conversations about a collaboration that was between Harvard Medical International and the Tuscan government. And it included the three universities in Tuscany. And those are Pisa, Florence, and Siena. So it was a great 8-year run.
It's phenomenal. So what exactly happens to your brain when you get a concussion?
This is one of those myths I want to clear up right away. Many people, when they think of concussion, they think it requires a head bonk, right? And that is not true. So a little physiology here. Concussions are acceleration, deceleration injuries. We refer to those as rotational injuries. And what that means is a mass is moving fast, you're running, and then all of a sudden it slows, it decelerates. And that can cause a concussion. So it doesn't require that you actually hit your head. You may be running, playing soccer, and you run into another kid. You don't actually bonk your head, but your brain has gone through that rotational energy, and that'll cause a concussion. Now, how? It's really stretching of the neurons, okay? We have these neuron fibers in our brain, and as that stretching occurs, it does damage. And in its worst phase, we refer to that as diffuse axonal injury, and it can be really severe. But in a more mild form, it can be a concussion.
What are the most common symptoms of a concussion?
I like to think of these in different ways. First of all, we have sort of physical symptoms, we have cognitive symptoms, we have emotional symptoms, and lastly, often sleep disturbances. So let me walk you through them one by one. Physical, the child may have nausea, vomiting, headache, balance problems, visual problems, often blurred vision, double vision. So these are like physical signs of a head injury, a concussion.
You said just kids, but kids and adults. These
Yeah, I did say kids, and I shouldn't have said that. These are symptoms that both children and adults can have. The next are cognitive types of problems. The child may be confused. They may be having problem with their memory. I often remember kids asking repetitive questions. Anytime a kid starts to ask you a question over and over, they ask you, "Hey, what's for dinner tonight?" And then 5 minutes later, "Hey, what's for dinner tonight?" Those types of repetitive questions are suggesting some type of cognitive problem. The kid may just be foggy, a little confused. Oftentimes, parents will say they're just off. Then the next one you get into are more the emotional types of problems. And we see these often in kids. This is sadness. Can even be as severe as depression. They may be angry or irritable. They're just acting in a way that isn't normal for how they usually are. And they might be more moody, more emotional than they had been previously. And then lastly, I think about sleep disturbances. And it can either be that they're sleeping too much. Kids tend to sleep a lot anyway, but now they're really sleeping a lot more than they normally would, or they're waking up more frequently, which is unusual in kids, and they're having difficulty sleeping. So that's the way I think about symptoms of a concussion. And the last thing I will mention here is you don't always see these symptoms immediately. They may take a little bit of time. Let me talk about why that is. Previously, when I talked about the stretching of the neurons, that causes a certain amount of swelling. It can cause inflammation, and that may take time to manifest. And so the child may be okay immediately after playing a sport. And by the way, you don't always need to be playing a sport. I hope that's clear. But they might be okay after, and then they develop the symptoms over the course of time.
How long do these symptoms usually last?
So the acute symptoms, the ones I just talked about, the nausea, the vomiting, headache, balance problems, will last on average for about 7 to 10 days. But it's really important here to remember that there's a time frame in general, and that'll vary between adults and kids. So first of all, kids who have maturing brains oftentimes need more time to actually heal the concussion. And that can be anywhere from 2 weeks to 4 weeks. So while you may have acute symptoms for 7 or 10 days, the actual healing process will take at least 2 weeks usually. But as I said, usually as many as 4 weeks. About 80% of kids will resolve in that time frame. But then another 20% of kids will continue to have them beyond that. Adults will heal more quickly, largely because their brain is already developed, and they're usually in the 1 to 2 weeks to heal the injury, but can be more than that.
Let's say you see your kid hits their head. You're concerned. You go to the ER, I guess. Is that what you're supposed to do?
Well, all right. So the truth is that you oftentimes don't need to go to the emergency department for what you perceive to be a concussion, but you do need to be evaluated by a medical professional. And so oftentimes, these injuries occur in the evening. They're after school. The kids are playing. That's the most common time that this happens. And so now all of a sudden it's 6 or 7 o'clock at night, and it's very hard to have a medical professional take care of them. And so you end up going to the emergency department or maybe even to urgent care.
And then is there a definitive test that says yes or no?
That's what makes this kind of tricky, Alex, is that, I wish there was a definitive test, but largely it's a clinical diagnosis. And what I mean by that is that we'll do a history. We'll get a sense for what the injury was, what was the mechanism of action. Number two, what happened at that time? Did the kid lose consciousness? Was there immediately symptoms that came on? The kid, had nausea and then vomited, headache started. So you get a history. We do a physical exam, and then we do a cognitive exam. But none of this is perfect. Okay. And so we end up having to put all of the pieces of the puzzle together and decide whether or not, from a clinical perspective, this is consistent with a concussion. Now, often I get asked about CT scans and MRIs. And CT scan is rarely necessary. MRIs are not necessary in the acute phase. CT scans are rarely necessary. The only time that I would consider doing a CT scan is if I was concerned the child had a bleed in the brain, whether it's arterial or venous, and then you might do a CT scan. But usually you don't need to do that.
Okay, so now you've diagnosed that the kid has a concussion. kid or adult. What does Dr. Ban then tell them to do?
Yeah, so old school was, hey, go sit in a dark room. We don't want you doing your homework. We don't want you, on your computer responding to work emails. That was kind of old school. Certainly in the very acute phase, the first day, that's fine to sort of allow the injury to subside to a certain extent. But then what we try to do, and this is almost mythbuster number 2, is we want people to return to early activity. Now, I want to be really clear about this, Alex. I just said return to early activity and not return to sports too soon. And so let's make sure that we go deeper into that. What does it mean to return to early activity, and why do we do it? Well, I'm thinking about walking. I'm thinking about a stationary bike. What you're trying to do is increase your blood flow. And then that increased blood flow is going to nourish the brain, and it's going to help with the inflammatory process that I talked about. It's going to help with the swelling. So this is another thing that a lot of people kind of aren't clear about, and that is, oh no, they shouldn't do anything. No, we definitely want them to start activity. Now, I should call out, when you do that, you may have worsening of symptoms. We expect that, okay? We use a 10-point scale to talk about symptoms. We allow for sort of 2 points of worsening. So if you're at a 4, we're okay with you going to a 6. We would expect that. And so this is what we want to get people back to early activity, but again, not back to playing until the concussion is completely healed.
Okay, early activity. Anything else?
Yes, we want to make sure that we're also beginning to stress the child from a cognitive perspective with puzzles, even during their homework. We want them to be exercising cognitive functions. And that was something that we didn't do in the past, but now we absolutely want to do that. So it's that combination of early activity and then cognitive stress that's going to help return the child back to normal more quickly.
And are there any medications that you prescribe?
Yeah, medications are interesting. Parents will ask us about this all the time. In the early phase, you want to stay with Tylenol, so acetaminophen. And the reason that is that acetaminophen, Tylenol, is a good pain medication, but it doesn't have an impact on bleeding. Okay, so most parents will know, like, it's a good pain medication, it's a good fever reducer. It's different than what we call the nonsteroidal anti-inflammatory drugs. That's Motrin, ibuprofen. Motrin and Advil are the trade names. It's ibuprofen. Those are also very good at anti-inflammation. They're going to decrease inflammation. They're good at pain control, but they also can cause a little bit of bleeding. So in the early days, stick with Tylenol, no Motrin, no Advil. Later, though, when you're 3-4 days into it, it's okay to move towards those medications that will also help decrease inflammation. The ibuprofen and the Motrin and Advil.
Okay, perfect. Are there is this like burns where there are different levels of concussion?
It's one of those things that bothers me because there's a tendency everywhere. It was true in Italy. It's true in this country to want to minimize concussions. And so when I say to you, yes, Alex, there are 3 grades, mild, moderate, and severe, most people are going to say, all right, mild's no big deal. Okay. And that is not the way I think about it at all. It is a brain injury, regardless of whether it's mild, moderate, or severe. But that is generally how we categorize a concussion in those 3 grades.
Why are younger kids more susceptible to concussions than adults?
For a couple of different reasons. First of all, they're more susceptible to head injury than adults. And that's because just think about you little kids.
They're running around all day.
Or they're running around like maniacs and, constantly doing that. But physiologically, their body, their anatomy is different than adult. Little kids have big heads, okay? A 2-year-old's head might be about 25% of their total body. By way of comparison, an adult is probably 10 to 12%. So they've got these big heads, right? They've got weak neck musculature, so they can't really protect the head from whipping back and forth. Their brains are developing. We use this term called myelinization, okay, which is the neurons are growing and becoming stronger. And while they're doing that, they're very susceptible. And then lastly, their skulls aren't as thick as the as I feel like there's a joke here, like the thick skull of us parents, but their skulls are thinner. So put that all together. You've got this wobbly head that's, all over the place. You've got the neurons that are still growing. And then you have this motion that happens, and you can get more easily a rotational force on the brain.
I want to flag a great animation that was done. Actually, it's not an animation, but it's a demo of an egg. I know there's no perfect analogy for the brain, but you sent me a YouTube video yesterday that was really interesting, and I think we should make sure we drop it in the notes, just because I think it kind of shows what happened with centrifugal force on a brain.
Yeah, I love the egg analogy, and you're right. You and I were shooting messages back and forth, and so folks can take a look at it. But it's a great analogy, right? Because an egg has a shell that's equivalent to our skull. There's the yolk, which is the brain. And then you have the egg whites, which is the fluid around the brain that is protecting the brain. Okay. And I'm not trying to say in any way, shape, or form that a brain is an egg. But when you think about that, if you shake an egg, okay, you're going to see that yolk sort of bounce up against the shell and then move back. And that's exactly what happens. And you see this really well in that YouTube video. And this made me think of another thing, Alex, too. When we think about shaken baby syndrome, which is, really horrific, that's why kids are so susceptible. If you take a child and shake them, they've got a big head, floppy, weak neck muscles. Their brain is developing. And that's why kids are susceptible to brain injury from shaken baby syndrome.
Okay. Prevention. Helmets. What else?
Yeah. So now in the context of understanding how we actually injure the brain, think about a helmet. So helmets, absolutely. Thumbs up. Okay. The thing about a helmet is it's not perfect, and it's not going to completely get rid of the risk, largely because of that rotational force. So you can have a helmet on, you could be running down the field, you could trip and fall to the ground and sort of bang your head against the ground, and still you have that deceleration that's going to cause the injury. So helmets are important. We're seeing them used a lot more. Of course, we use them in football, but they're using them in hockey, lacrosse, skiers now. It's become culture always to wear a helmet. So helmets are great, but won't protect you 100%.
Got it.
I think there's a lot of awareness about concussions that we didn't have when you and I were young, for example. When I was young, I played football, and it was called getting your bell rung, right? You saw stars. We absolutely minimized head injuries, and it was like, hey, get back in there right away. And that was a sign of courage. That's changed. And people are aware now, and coaches are aware, parents are aware, and that is important because we're now pulling those kids out and we're putting them into the right protocols so that we give them time to heal. So awareness is a big deal. Coaching is a big deal. Nowadays, we are coaching kids in contact sports to tackle properly, to head the ball properly in soccer. In hockey, we're trying to be careful when the kids start to check about how they do that. There's one other thing that's really important, and that is that we are starting to close the window in which a kid can have a brain injury. If you start playing football when you're 8 years old, let's do easy math, and you play all the way through to your senior year in high school, you've got 10 years where you are susceptible, or you're exposed to, you have the chance of getting a concussion. And we're really concerned about cumulative concussions. Now, if you close that window by saying, hey, look, no contact football, we're going to play flag football all the way through 8th grade. And then when you go to high school, you can play contact football. Now that window is 4 years. Okay. And so you're decreasing the amount of time that the kid is actually susceptible to getting a concussion, and you're going to decrease the cumulative effect of having multiple concussions.
What about the cumulative effect of concussions? Why is it much more problematic to have a number of concussions than a single concussion?
If you take nothing else away from today's episode, it would be exactly that. We see a cumulative effect that progressively injures the brain, such that even as few as 3 concussions, 2 or 3 concussions, can have a negative impact on the brain that sustains itself all the way into adulthood. So a child is injured with as few as 3 concussions, and you can see a negative impact on memory, executive skills, planning, all the way into adulthood.
Kevin, how are concussions and CTE, and I'm going to look at my notes, which is chronic traumatic encephalopathy. I think I got it. How are they related?
Well, you got it. You pronounced it perfectly. So we just talked about the cumulative effect of multiple brain injuries. We're learning a lot about CTE these days, and let me just explain that is a chronic degenerative brain disease that seems to come from multiple injuries. And so that cumulative effect that I referred to earlier, in its most severe form, can lead to CTE. Now, CTE is not something that you'll be able to identify often immediately. It's one of those things that over the course of time, it starts to manifest itself and it starts to show itself.
But you can't actually confirm CTE actually until you have a posthumously, correct?
That's right, exactly. So let's do a little physiology here. And that is that we are beginning to recognize that there is a certain pattern to something called tau proteins, okay? They start to bundle up, they start to create a tangle, and we're able to see, again, in autopsy, these tau protein bundles or tangles that are consistent with CTE. Now, we see tau protein bundles in other degenerative brain diseases like Alzheimer's and dementia, but the pattern for these particular tangles is different than for CTE than it is for dementia or Alzheimer's. So we're really having mounting information that as you have a cumulative brain injury, you're developing these tau protein tangles, and that's what we call CTE.
There was a study I know that Boston University did on autopsies of a number of young people's brains where they found evidence of CTE. What are the details of that study?
Yeah, this is really important to clear up. I've been asked this question before. This study, to your point, was done here in Boston at Boston University. It was published in JAMA Neurology in August of last year. And what I would say about this is parents often want to know, hey, what is the likelihood that my kid is going to develop CTE, especially if they've had multiple concussions? And this study is important. But it is, I got to make this very clear, it is a biased sample because parents thought their children might have CTE. Tragically, a lot of these kids committed suicide. And so the parents had a reason to want to donate their child's brain to Boston University for this research. But we call that a biased sample. And so I just want to be very cautionary. But in those kids, about 41% of them had CTE. And that was thought to be the cumulative effect of concussions.
Dr. Ban, thank you very much for all that incredibly interesting information on concussions. At the end of every case, I summarize what I heard, and you let me know if I missed anything. You don't need to hit your head to get a concussion. There's no definitive test for concussions, which is fascinating. It's a brain injury, a concussion. Do not minimize any brain injury. Awareness has grown. Helmets have helped. Fascinating that the treatment protocol has changed. So doctors now advocate kids returning to early activity and adults returning, when they're ready, returning to early activity.
You really summarized that well. There's one thing I thought of that we didn't discuss. I think it's helpful to talk about, and that's the concept of waking kids up. That was very old school. It was like, oh, my kid has hit their head. Can't let them sleep through the night. That has changed. Okay. To a certain extent, we confounded it with other diseases of the brain after trauma, like a bleed in the brain, whether it's an arterial bleed or a venous bleed. Instead, for concussions, we actually want to encourage sleep because that's when the reparative process occurs. So it's unnecessary to wake your child up multiple times throughout the night. You want them to get a good night's rest so they can heal.
Got it.
C2 Sense is doing important work with its Halo platform, applying technological advances in chemistry, machine vision, and material science to provide both patients and providers with laboratory-level accuracy at low cost when they need it. The pandemic reinforced the importance of being able to test in the privacy of your own home. C2Sense's goal is to use that patented technology to ensure the same quality of testing you would find in your doctor's office in the comfort of your own home. So if you're suffering from upper respiratory symptoms like cough, sore throat, nasal congestion, or headache, keep your eyes out for C2Sense as they are developing tests targeting upper respiratory conditions such as COVID and flu. If you want to learn more, see what they're up to at haloreader.com.
Case 2 is about the former Surgeon General and something that happened to him recently, and Kevin is going to give us all the details.
Right. So Dr. Jerome Adams was the former Surgeon General. I think he served between 2017 and 2021. And apparently earlier this year in February, he was on a business trip to Arizona, took advantage of being in a beautiful place. It was really hot, went for a hike. And later that night, started at a dinner, started to feel lightheaded. He was dizzy. So he ended up going to the emergency department, and he put up this post on X, and I'll just read it for the people who are listening. Recently, I had an ER visit for dehydration while out of town. Received some labs and 3 IV bags, so IV fluids. Here's the bill. After insurance, it's no wonder medical debt is at the top of causes of bankruptcy in the United States. And the bill is for $4,896.43.
There's a lot to unpack here. Why so expensive?
Yeah, there are a couple of things to consider here. The first thing is that he was traveling, right? He was in a different state. So just, by definition, wherever he went for care, he was going to be out of network. So this was an out of network visit. Number 2, he went to an emergency department, and we know that emergency departments are expensive places where to gain care. Let me explain why that is. Now, when you go to the emergency department, their job is to make sure that there is no life threat and no limb threat. So that means that oftentimes they're going to be doing some testing, sometimes advanced testing, and all of those things can cause cost a lot of money. In fact, Dr. Adams reported that his blood tests were at this particular hospital 11 times more than the going rate in that area. The EKG that he got was 3 times more than the going rate in that particular area. He reported that the X-ray was like 2 times more expensive than others in that area. So he went to not only an expensive place to gain care or get care, but also apparently a very expensive hospital. And then the third piece is that in the post, he talks about after insurance, I paid almost $5,000. That suggests to me that he has a high deductible insurance plan.
So Kevin, exactly how does high deductible insurance work?
High deductible insurance offers a lower premium, a lower monthly premium with a higher out-of-pocket deductible. The premium is something that you pay every month. And for a lot of us, we've seen our health care costs go up. And so we want to do everything we can to minimize the monthly spends. That's the premium. The deductible is the amount of money that you spend before your insurance kicks in. Some of these plans will get pretty high. I mean, for example, to be considered a high deductible insurance plan, it has to be at least $1,600 per person, but it can be all the way up to $8,000 per person. Okay. And for families, it's normally at least $3,200, but it can be all the way up to $16,000. So, people really have to understand which insurance product they have. If it's high deductible, you have to know that because if you need care, you're going to probably have to pay a lot out of pocket before insurance companies will kick in. So what happens is, oftentimes these people cannot afford to pay for care. And so what they start to do is they either delay care or they don't get care at all. And that's a really big problem with high deductible insurance plans. One of the things that people have to know is that preventative care is covered in a high deductible insurance plan by your premium. So when you go to the doctor, let's say you're taking the kids in for that annual check with the pediatrician, it's covered. If they're going to get a vaccination during that visit, it's covered. cancer screenings like, colonoscopies and mammograms, all covered. And you will not have to pay out of pocket for that. It will not go towards your deductible. And that's a really key point.
Got it. Okay, medical debt, which is another thing he talks about, which I think is really obviously something very important and something I know you care a lot about and something we're going to try and help the audience with. We were talking the other day as we were preparing for the show, and you walked me through an HSA, which I shouldn't admit that I don't have, but I don't. And you think that I should get one, and I now will. So could you tell us all what HSAs are?
Well, the idea of the high deductible insurance is that it would be for people who are healthy for the most part, and that often wouldn't need much more than preventative care. And so what they did is they said, look, we'll have a lower premium, we're going to have a higher deductible, but then we're going to expect that people are going to put money away every month into what you called an HSA, a health savings account. And what's interesting is that not everyone does that, okay? So what the idea is, you're paying your premium, but you're also putting money into this HSA. It goes in tax-free, it grows tax-free, and it comes out tax-free if you use it for healthcare. So it's a really good plan. My greatest concern, Alex, is that people aren't doing this overwhelmingly. I mean, many people do, but not everyone. And so you can find yourself in a situation where if all of a sudden you need care, you end up having to write a big check. That concerns me. I don't know if you remember, there was a study that came out a few years ago, and it talked about how over 40% of Americans could not write a check for $400 without borrowing money. So now all of a sudden, if I tell you, you have a high deductible insurance of, let's call it $2,000, you go to the hospital and need care, you're going to need to pay that first $2,000. And if people are struggling to pay even $400, that's where we land in a really, really difficult situation. If you're young, if you're healthy, if you're able to put money away into that HSA, it can be a very good idea. But if you're older, if you have chronic medical problems, it just may not be the right plan for you, and you should just go with traditional insurance.
I'm young at heart, Kevin, so I will be opening my HSA. Thank you. Let's say the same thing happens to me. I'm traveling or someone in our audience, and you have to go to the ER, unfortunately, and you get a high bill. Is there anything you can do about it versus just having to pay it immediately?
Yeah, without question. And you're right, Alex. Like, most people just pay it. And the most they'll do is call the hospital and come up with a payment plan. But yeah, there are some things that you absolutely should do. Number one, make sure you ask for the itemized list of charges. You want to get the bill with every charge you've gotten. This is a key factor. So you have to first get the information. Number two, you want to take a look at that and make sure it looks right to you. Sometimes you see double charges. Sometimes there are things that never even happened. So you want to make sure that it's the right bill. The next piece, and this is more difficult, is you want to get a sense for whether or not it was appropriate. Now, I don't think many people can do that if they don't have a medical background on their own. And so this is the time to ask for help. There are actually companies, not-for-profit companies out there, Alex, that will help you. Now, there's an article in USA Today that I read that does a really nice job of going through this and then offers you some opportunities to go to companies who are not-for-profit to help you with these situations. And we'll be sure to drop that into the show notes.
That's great. That's really helpful. Thank you, Kevin. To our audience, please let us know what topics you'd like us to cover. Healthcare, health, wellness. Please go onto our YouTube channel, leave us a message. We will cover as many of them as we can. And the way we conclude the show every week is with Dr. Ban sharing some beauty.
And I've got a great one for you this time, Alex. This is a video that comes from 2018, so it's a bit classic, of an 8-year-old Japanese drummer by the name of Yoyokuma Soma, who crushed it playing the Led Zeppelin. It was so joyful and it was so wonderful that I decided to share it as beauty this time. I want to thank everyone in our community for being a part of this. This show was made possible and produced by Batsheva Gez. Thank you, Shev. And to all you folks, see you next time.
See you next time.
This show's content represents the personal opinions of Alex Wallace and me. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not create a physician-patient relationship with me. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or your general health.